Today we're going to talk about QL spasms and why they're happening and what you can do to solve those. QL stands for Quadratus Lumborum. Often practitioners will point to the QL as the cause of someone's one-sided back pain, sciatic pain, SI joint pain, etc. But the QL does not operate alone. And usually there is a cluster of other things that are going on in addition to the QL spasm that is causing that pain or that is causing the QL spasm in the first place. So we're going to break this down as to what my take is on QL spasms and how I solve them. The QL runs from the pelvis to the top, to the lowest rib here, and also the vertebrae in between. It does often go into spasm. And the question we need to ask though is, why is it going into spasm? Well, I can't remember the last case that this didn't happen, but usually the side that is in spasm, the pelvis is resting higher and the rib cage is resting lower. And this is what I call a side bending problem. And this, you can imagine that if the pelvis is higher on one side and lower on the other, that the muscles in between must be in spasm or shortened in some way, the QL being one of those. This pattern is often blamed for leg length discrepancy. So if you have a QL spasm, someone might be saying that you have a leg length discrepancy that's causing the QL spasm, and but usually this is also part of the same pattern of issues. So why is this side bending pattern occurring? And usually it's because of some older problem on the same leg in 80 to 90% of the cases that I found clinically. And what happens is, because of this older problem, there is a series of events that occurs that the brain then causes the pelvis to be elevated, and the same muscles that elevate the pelvis also attach to the rib cage, the QL being one of them, and pull the rib cage down, creating this side bending issue. And you can imagine that if you have a side bending problem, you have increased compression on this side of the spine and the sciatic nerve roots that comprise the sciatic nerve running down the leg. So like I said, in 80 to 90% of the cases, it's due to an older problem in the same leg. And in 10 to 20% of the cases I found, the problem is happening because of the other leg. How can you figure this out? Well, I've made this video to help you test where some of these older problems might be coming from in terms of which leg they might be appearing from. So please watch that. And then the video after that here talks about how to interpret your results. All right, I also mentioned side bending problems in this video about sciatic pain because it's the same problem as in that video. So the focus shouldn't be on targeting the QL, because the QL is responding to larger systemic problems in the body. And if you're watching this video, you've probably been to, physical therapists, massage therapists, chiropractors, and what have you, who keep on massaging the QL and trying to get it to release, and maybe they do temporarily, but it keeps coming back. And why? It's because they're not addressing the larger systemic problems, such as older lower extremity problems that are causing this pattern to occur, and therefore the QL strain. I'm going to take a break here and please ask you to subscribe, like, and share this video with others who might be suffering from problems to help them too. Thanks. So what kind of problems can happen in the lower body? Well, it can happen, anything can cause this pattern to occur. And it could be old ankle sprains, plantar fasciitis, Achilles tendonitis. It could be knee issues. It could be hip issues. It could be any number of problems in the lower body system that maybe weren't rehabbed adequately at the time. And so what your brain has done is it's figured out a way to get around those deficiencies in your lower body system. One of the ways the brain does this is by getting you off the problem. So like I said, in 80 to 90% of the cases, if the problem is here, your brain is saying, oh, well, if you're not going to solve this problem, then I'm going to get off of it because you're making me, go from A to B, play these sports, exercise, all this kind of stuff, and there's a problem here that you're not addressing. So the brain says, well, if you're not going to address that problem, I'm just going to do this to get off of that problem so that we can do all those sports, recreational activities, work, what have you. And this is basically how it works. And so whatever that older problem is, your brain is just getting off of it. It's same thing as if you have a pebble in your shoe. Well, you're not going to weight bear on that pebble all day long just as hard as if it wasn't in your shoe. You will subtly shift your weight off of that pebble so it doesn't hurt you so much. And that's exactly what the brain is doing after years and years of contending with unresolved problems. Now, the same thing can happen. Ankle issues, plantar fasciitis, knee, hip, whatever, can happen over here. And then what happens is the brain says, oh, well, if you're not going to solve this, I'm just going to get off of this leg then and go over and spend more time on this leg because this leg doesn't hurt me and this leg does. And so what happens is this is temporarily successful, but what happens is over time, the leg that you're weight bearing more on, because it's doing 10, 20, 50% more work, it starts to break down over time. And therefore, the brain says, wait, I can't get back over to this leg because of that old injury, and now this leg is breaking down, so I'm just going to get off of that leg as much as I can by creating a side bending problem. So that's typically what is going on behind QL spasms, any other unilateral back pain, sciatic pain, SI joint pain, things like that. This side bending pattern is the reason that is happening. And these lower body problems are the reason the side bending problem is happening. So I would encourage you, if you have a chronic QL strain, spasm, or any other thing like that, to dive deeply into your history. And here's the thing about doing this is that most people are not taught to understand how to link older problems to current pain. And so you will likely have mental blocks as to, well, that couldn't possibly be the cause of this. Well, yes, it certainly can be. I mean, you wouldn't believe how many people are surprised to find some older, what seemed to be an innocuous injury is the cause of their unilateral or sciatic pain, back pain, SI joint pain, hip pain, or bilateral back pain, or what have you. The body is amazing at helping you succeed by getting from A to B like what you're always asking it to. And it does that by creating these compensations that then over time catch up to you. So look back in your history and see if you can come up, just make a list of all injuries from childhood to current, and you may see the possible links between your current QL spasm and your older injuries. Again, please watch this video to understand which leg those older injuries likely are coming from, and watch the results video about how to interpret that test, and then watch the sciatic pain video to show you how in that video I show you how to measure for the side bending problem in the first place. All of my other videos that I've made all address all the potential problems that could be contributing to this. So if you haven't scoured my video list, please watch my videos and just sit down and you'll learn so much about what could possibly be going wrong that would be contributing to this or other types of pain. I hope that helps you solve your QL spasm.